What do audiogram terms and results mean? Imagine you're trying to understand what your hearing test results really say about your hearing health. An audiogram is like a map that shows how well you hear different pitches and volumes. It's a key tool used by hearing specialists to figure out if you have hearing loss, what kind it might be, and how severe it is. When you get an audiogram, it's a graph with two main parts. The vertical line showing how soft or loud a sound is in decibels hearing level, and the horizontal line showing different pitches or frequencies in hertz. The lower the decibel number, the better your hearing, because it means you can hear quieter sounds. Normal hearing usually means your thresholds are 25 decibels or better across most frequencies. The test covers a range of sounds from low pitches, like a deep drum, to high pitches, like a bird chirping. This helps identify if you have trouble hearing high-frequency sounds, which is common with age-related hearing loss or noise damage. During testing, two types of measurements are taken: air conduction and bone conduction. Air conduction uses headphones to send sounds through your outer and middle ear, testing your overall hearing ability. Bone conduction sends vibrations directly to your inner ear through a device placed on your skull, bypassing the outer and middle ear. Comparing these results helps determine if your hearing loss is due to issues in the outer or middle ear, called conductive hearing loss, or if it's related to the inner ear or nerve, known as sensorineural hearing loss. In a typical audiogram, if the bone conduction thresholds are normal but the air conduction thresholds are worse, with a gap between them, it suggests conductive hearing loss. This might be caused by earwax buildup, infections, or eardrum problems. If both air and bone conduction thresholds are equally elevated, it indicates sensorineural hearing loss, which involves damage to the cochlea or auditory nerve. Sometimes both types are present, leading to mixed hearing loss, which shows elevated thresholds in both tests along with an air-bone gap. The severity of hearing loss is classified based on the decibel level. Normal hearing is from 0 to 25 decibels. Mild hearing loss ranges from 26 to 40 decibels, making it harder to hear soft sounds. Moderate loss is from 41 to 55 decibels, and it becomes more noticeable. Moderately severe hearing loss is from 56 to 70 decibels, severe is from 71 to 90 decibels, and profound hearing loss is anything above 90 decibels. These levels help audiologists recommend the best treatment options, like hearing aids or other interventions. The shape or pattern of the audiogram can tell us more about the cause of hearing loss. A flat audiogram means hearing loss is similar across all pitches. A sloping audiogram shows worse hearing at higher pitches, which is common with age-related loss. A notch at a specific frequency, often around 4,000 Hz, can suggest noise-induced damage. Rising audiograms, where hearing is worse in low frequencies, are less common but can happen in certain conditions. Hearing loss can be symmetrical, meaning both ears are affected equally, or asymmetrical, where one ear is worse than the other. Asymmetrical loss might need further investigation to rule out other health issues like tumors. Also, if your thresholds worsen over time, such as a drop of 15 decibels at one frequency or 20 decibels at two neighboring frequencies, it could mean your hearing is getting worse, often due to noise exposure or aging. Sometimes, additional tests like tympanometry or acoustic reflex testing are used alongside audiograms. These help assess how well your middle ear is functioning and can help differentiate between conductive and sensorineural loss. All these results combined give a detailed picture of your hearing health, guiding your healthcare provider in recommending the right treatment or further testing. Remember, everyone's hearing is unique, so it's important to discuss your specific results with a qualified audiologist or hearing specialist. They can interpret your audiogram accurately and help you understand what it means for your hearing and overall health.